This was an interesting journey down the rabbit hole to figure out if mental health is a big problem in India, if it's a problem that presents an interesting business opportunity, or if it's one of those problems that it's a social cause and we need to figure out how to solve for it. And I'll give you the final answer right now. I think mental health is as good a business opportunity as it is a social cause that we need to figure out by CSR, by investing in this, by not looking for profits out of this, right? So it's a thin balance that we need to figure out there. But my God, the numbers are ugly. I did not know it was this big a problem. So, according to a study that was done by Lancet, 1 in 7 people in India is affected by a mental disorder. So, that's about 14% of the country is affected by mental disorder, some sort of mental disorders. And I will qualify this by saying that the range or spectrum of mental disorders is pretty large. There are few, on the extreme side of segment where it's a crippling disease to live with, the severe depressions, the severe anxiety. And I have a personal story. A few people know it. I've written about it. My dad suffered from depression for 7 years, and he eventually took his life. Right. So I know how big a problem this is. I just didn't know how bad a situation it is outside. Right. While he had access to psychiatrists and psychologists, and we tried our best to figure this out. Even then, it was a issue that persisted on and off for 7 years, and eventually resulted in what it resulted in. But the numbers that we're talking about is between 8 to 14, 15% of India has some sort of mental disorders. Roughly 56 million people suffer from depression, and 38 million people suffer from anxiety disorder. These are the most common terms that you hear when you talk about mental health: depression, anxiety. And as I said, this is a wide spectrum. There are different kinds of mental disorders. So I'm not saying these are the only two. The other thing that I found was the supply of psychiatrists and psychologists and care practitioners, right? Nurses that know how to deal with mental health patients is extremely low in India, right? For a population, let's assume 10% of the country is suffering from some sort of mental disorder. That's 13 crore people. We have a total of 9,000 psychiatrists, 9 to 10,000 psychiatrists, depending on the numbers that you find online, depending on the dates. We have about 2,000 psychiatric nurses. So these are trained people who can take care of mental health patients. We have 1,000 or 1,500 clinical psychologists, right? We're talking numbers that can't even meet a size 1/10 of the country, right? Like if we or 1/5 of the country, right? It's the numbers are extremely small, and
I'm
that's
actually
one of the biggest
wondering.
problems.
I'm
Yeah,
wondering if this is even enough just for one city. Like, is this enough just for Bombay for 20 million people?
yeah,
Maybe, maybe
it's
not.
it's insane, right? What we have to understand though is a large segment of people that are suffering from depression, anxiety, and the other kinds of mental disorders, in that one 13 crore people, they're not going to be able to access this healthcare at the cost that it is being offered at by the private institutions, right? Whenever we talk about a therapist or a psychiatrist, the fees are pretty high. This is one of the common complaints about when you talk about getting a therapist, when you talk about going for mental health checkups. It's a fairly expensive affair, and not a lot of insurance companies cover it. So a large portion of India is technically ruled out of it just purely on the cost basis. Forget the supply, forget whatnot, which is where the government has to play a very, very important role. And again, to my surprise, this is a topic that's been discussed since 1984. There was a mental health policy that came out in 1984, and it's been revised multiple times, and there have been various versions of it. And then 2017 is the last major revision that happened in the mental health policy. The government passed this bill called the Mental Healthcare Act in 2017 that lays down in fairly detail on the rights of somebody who's suffering from mental disorders, and different types of things that you need to do, and right to legal aid, and right to information, and different things about mental health. I'm not going to go too much into the act itself, because whatever I've read, I think the act has failed, right? I don't think the act has been implemented well. I don't think the act has been taken with any sincerity or seriousness by the government officials. And I will say that, it is a long term thing that we need to solve. For the centers need to work with state governments, and a lot of things need to happen. So I'm not denying the fact that nobody has done anything. But if you look at how much we allocate for this, right? We allocate 40 crores in a year for mental health in India at the budget level, right? And it was 50 last year or something, and then we reduced it to 40 crores. 40 crores is scraping the surface in trying to really solve this problem. There's a fantastic article about the cost of mental health to India, right? Like cost of the mental disorders to India, and they go through various kinds of calculation on the loss on employment that people go through mental disorders, the caregivers who have to sort of lose out on employment, and the complete cost of it is in thousands of crores. I'm going to link that article. I don't want to misquote numbers. And the actual implementation of the 2017 act, if we were to do it seriously, is also going to cost us thousands of crores. So 40 crores is not really doing anything in that sense. What I got out of this entire thing is the situation is pretty grim.
What's shocking is that 40 crores that you just mentioned is the same amount that Indians are spending on all of these resold sneakers. It's a minuscule number. We should not be able to compare this luxury sneaker market to the amount that we're spending on mental health. That's insane.
One of the initiatives that the government launched in this one, and I hope over the years it becomes better, and this is the only way to solve it at scale, is there were telehealth clinics that were set up specifically for mental health in vernacular languages in different parts of the country. If I'm not wrong, there were 23 of these units that were set up. The reason why I say telehealth and digital is the only way we can solve it is because, as I said, the supply of psychiatrists and psychologists are so low that we can't physically cover this area in any way or form. It's going to take years for us to sort of figure out how to meet the supply and demand in terms of people who need the help versus people who can offer the help. Which is why the digital aspect of it becomes extremely important.